Welcome to Section 2 of Public Health Sciences. In this video, we'll discuss consent and confidentiality. Let's get started. As the title suggests, we only have two concepts to cover in this lecture, consent and confidentiality. Let's start by discussing consent. There are two major components of consent relevant to the practice of medicine: informed consent and consent for minors. Informed consent entails more than just the form patients are required to sign before a procedure. As the name implies, the patient must really be informed. This means the patient must not only be presented with the appropriate information, including risks and benefits of treatment and alternative options, but he or she must also demonstrate understanding and have decision-making capacity. The consent portion of informed consent means that the patient cannot be coerced and his or her agreement to treatment must be voluntary. While you must obtain informed consent in the vast majority of scenarios, there are a few exceptions. The first exception is that a patient may explicitly waive their right to informed consent, so a waiver. This is uncommon, but could be indicated in situations where the patient feels that understanding the risks and benefits would be traumatizing, or decides they would prefer to have a family member make decisions on their behalf. The second exception is if a patient legally lacks decision-making capacity because of severe illness or mental impairment. The legal term for this is to be incompetent. The third exception is in emergency situations, where there may not be time to properly inform the patient before implementing life-saving measures. And finally, the last exception is known as therapeutic privilege. The first three exceptions are pretty straightforward, but this last one is a little more complex. Essentially, it refers to withholding some information when that information may be severely harmful to the patient. This could be invoked if, for instance, telling a patient the specific name of a psychiatric diagnosis could present a barrier to their treatment or potentially cause psychological harm. Let's do a quick practice question on this concept before moving on. A 26-year-old female presents to the emergency department with increasing abdominal pain. She is diagnosed with appendicitis and informed consent is obtained for urgent surgical intervention. However, an hour later, as she is being led back to the operating room, she changes her mind and decides she would rather go without surgery. As the intern on the surgical team, you explain to her the risks and benefits of the procedure again and stress the danger of delaying surgery. She expresses understanding but continues to refuse surgery. What should you do? A. Perform the surgery as informed consent was previously obtained. B. Agree to delay the surgery in accordance with the patient's wishes. C. Contact the patient's parents and husband to obtain consent for the procedure from them. Or D. Consult psychiatry to determine the patient's capacity to make this decision. Okay, while this patient is clearly acting against medical advice and could be putting her life in danger, she meets the criteria for having capacity to make decisions for herself. The only exception that might be valid in this case is that this could be considered an emergency situation. However, a competent patient who shows no signs of mental incapacity is within his or her rights to refuse even life-saving treatment. There is no need to consult psychiatry to make a determination of capacity, as you are her primary care team and can do this yourself, and while her parents or husband may be able to change her mind, she ultimately has to make the decision for herself and can remove her consent even after it has been previously obtained. So the correct answer is B. Agree to delay the surgery in accordance with the patient's wishes. A is wrong because a patient can change their mind at any point in time, even if consent was previously obtained. C is wrong because the patient is fully coherent and can make the decision for herself. And D is wrong for a similar reason. All right, now let's discuss consent for minors. Laws surrounding consent for minors, meaning anyone under 18 years of age, vary by state. But generally speaking, parents must consent to treatment for their children. The only exceptions to this are issues surrounding sex, such as contraception, pregnancy, and STIs. Drug use, trauma or emergencies, or if a minor has been legally emancipated, are also exceptions. In these situations, minors can consent for themselves and parents are not required to provide consent. That said, healthy communication between minors and their parents should always be encouraged, even if you are not required to involve the parents in consenting to treatment. Minors should also always be consulted and their agreement sought before initiating any intervention, even if their parents have the ultimate legal say. Let's do a quick practice question on this concept before moving on. A 2-year-old patient is brought to the emergency department by his babysitter. The patient has sustained multiple injuries to the head after falling from the top bunk of a bunk bed onto a bedside table while playing with his 4-year-old brother. His vitals are currently stable. An exam shows an obviously fractured left wrist with bruising on the left side of the head. He is in a great deal of distress and won't stop crying, but appears to be okay otherwise. The babysitter has not been able to contact the parents. What should you do next? Continue to attempt to contact the parents to obtain consent before administering any treatment to the child. B. obtain consent for treatment from the babysitter. C. Treat the child as if consent had been provided. Or D. Perform diagnostic tests and administer pain medications, but refrain from any surgical intervention until the parents can be contacted. Okay, this question involves obtaining consent for a minor. The parents are unable to be contacted. However, this situation would qualify as an emergency, and the patient could be administered reasonable treatment as if consent had been obtained. Therefore, the correct answer is C. Treat the child as if consent had been provided. A is incorrect because while attempts to contact the parents should continue, treatment should be administered regardless. B is incorrect because the babysitter has no legal ability to consent for the child. D is incorrect because if diagnostic tests were to reveal a need for surgical intervention, then this would have to be done immediately, even without the parents' consent. It would be inappropriate to wait for consent if the minor's life were in danger. Okay, now that we've gone over consent, let's discuss confidentiality. There is a well-understood expectation of confidentiality between doctors and their patients. Keeping doctor-patient interactions confidential is vital for preserving the privacy and autonomy of patients. There are exceptions, though, that the USMLE examiners love to test you on. They all tend to stem from the general principle of potential harm to self or others that the physician is in a position to prevent, but cannot do so without breaking the confidential relationship with the patient. Here's a list of cases in which confidentiality can be broken. The first instance is when a patient has suicidal or homicidal intent. The second is if they are victims of abuse. The third is in the case of epileptic patients or other patients with a seizure disorder, as they should not be allowed to have a driver's license. Finally, patients' consent can be violated if they are found to have a disease that must be reported to the state health department. Some examples of this are syphilis, chlamydia, and Ebola. Okay, now that we've reviewed the concepts, let's do a couple of practice questions. An 84-year-old woman with mild dementia presents to your office for follow-up of an infected foot ulcer. She has completed a course of antibiotics and her foot ulcer looks mostly healed. During the exam, you notice that her appearance is disheveled and she is very underweight. Upon further questioning, you learn that the patient lives with her son, but that he works very long hours and isn't home often. She cannot drive and lives in a remote area by herself. She pleads with you not to tell anyone that she is struggling, as she is very embarrassed and also doesn't want her son to get in trouble for anything. What is the best course of action? A. Call the police and report her son for elder neglect/abuse. B. Reassure the patient that your discussion will remain confidential. C. Talk to the patient's son and discuss your concerns about his mother. Or D. Discuss the case with your office's social worker and report the case to the appropriate state authority. Okay, hopefully from the question stem, you notice that this is a case of elder neglect or abuse. The patient is clearly not being well cared for in her current circumstance, as evidenced by her disheveled appearance, infected foot ulcer, and malnourishment. She doesn't want you to tell anyone. However, this situation is a classic exception to confidentiality rules, and something must be done. In addressing the issue, more help should be enlisted, and it's appropriate to break confidentiality and even go against the patient's will, which violates her right to autonomy. This is done in order to do what's in her best interest, in accordance with the principle of beneficence. In this case, the correct answer is D. Discuss the case with your office's social worker and report the case to the appropriate state authority. Let's briefly go over why the other answers are incorrect. A is incorrect because although it's possible that the son is intentionally neglecting his mother, it's more likely that he is busy and overwhelmed. Calling the police would be a little extreme in this circumstance, and the case should instead be referred to the proper state authority, such as an agency that deals with protection of vulnerable populations. So A is incorrect. B is incorrect because the patient is in an unhealthy situation and something must be done to help her. C is incorrect because although it's best to give the son the benefit of the doubt, it is not a good idea to directly confront a patient's abuser. Further help should be enlisted and the appropriate state authority must be informed. So C is incorrect. And again, the correct answer is D. All right, let's do one more question. A 16-year-old female presents to the emergency department with dysuria. She is diagnosed with chlamydia and gonorrhea. She begs you to not tell her parents or her boyfriend and agrees to whatever treatment you recommend. What is the best course of action? A. Start treatment and agree to withhold the information from her parents, but report the infection to the health department, knowing that they will contact her boyfriend. B. Agree to keep the information confidential and start the patient on antibiotic therapy. C. Report the infection to the health department and inform her parents and boyfriend of her diagnosis. Or D. Urge the patient to tell her parents and boyfriend herself and start her on antibiotic therapy. Okay, recall that STIs are one of the exceptions to confidentiality when dealing with minors. While it is acceptable to withhold the information from the patient's parents, STIs, such as chlamydia, must be reported to the health department, who will ensure that her boyfriend is contacted so that he can receive treatment as well. While it's good to urge the patient to tell her parents and boyfriend herself, this is not enough. The physician must report the diagnosis to the health department, and the boyfriend must be notified to prevent spread of the infection. Therefore, the correct answer is A. Start treatment and agree to withhold the information from her parents, but report the infection to the health department, knowing that they will contact her boyfriend. B is incorrect because the health department must be informed in order to stop the spread of infection and ensure the boyfriend is treated. C is incorrect because it's not necessary to inform the parents of the patient's diagnosis before initiating treatment. And D is incorrect because the infection must be reported to the state health department. And with that, we've covered everything you need to know about consent and confidentiality.